Hello, my name is Dr. MarkAlain Dery, and I am the Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana, the largest Medicaid providing clinic system in Louisiana, and the co-chair for the ACOI Infectious Diseases Specialty subsection. Along with the leadership of the ACOI, we want to thank you for all that you are doing as we face this unprecedented time in medicine fighting the COVID-19 virus. Moving forward, in conjunction with the ACOI, we want to share with you some information as it becomes available, as well as some of the bright spots that we are seeing so that we can all feel some hope in these trying times. So, in terms of news, the NIH panel guidelines. So, the COVID-19 pandemic has exploded, as we know, since cases were first reported in China in 2020. As of today, April 23rd, 2020, more than 2.7 million cases of COVID-19 caused by the SARS-CoV-2 virus have been reported globally, causing almost 200,000 deaths. Cases have been reported in more than 180 countries, including all of the 50 states of the United States. So last week, we spoke about the Infectious Diseases Society of America guidelines, the IDSA, and how they were so-called quote-unquote living guidelines, and they will be updating them as data from new clinical trials now become available. So now the National Institutes of Health, the NIH panel, has also released guidelines that are also living guidelines on treating patients with COVID-19, and I wanted to review some of those guidelines with you. So here are some of the highlights. One, the panel does not recommend any drug for pre or post-exposure prophylaxis outside of any clinical trials. It does not, it does not make any recommendation for any specific antiviral or immunomodulatory treatments, as no drug has now been proven to be safe and or effective. The panel also does provide some rationale for the use of certain therapies under investigation, as well as a summary of studies on these treatments. 3, it does come out against the use of hydroxychloroquine plus azithromycin outside of a clinical trial because of its, obviously of its toxicity risk, as well as the use of lopinavir and ritonavir or other HIV protease inhibitors because clinical trials have shown to be negative thus far, as well as unfavorable pharmacodynamics. The panel also recommends against any interferons or Janus kinase inhibitors. The group also recommends against the use of any systemic corticosteroids for mechanical ventilated patients with COVID-19 who don't have acute respiratory distress syndrome, and it also prefers low-dose corticosteroids over no corticosteroids in patients with refractory shock. So one of the things that we also want to acknowledge is the mental health of our healthcare workers as we are all undergoing significant stress and anxiety at this time. So when we think of the peril of our healthcare workers and what they're facing during this pandemic, what is often overlooked is the mental health state of our physicians and the workers on the front lines. When I think of emotional stress that we are all facing, I envision lots of different scenarios, and I envision the trauma of hospitals suddenly becoming transformed into basically huge ICU wards. And I think of the anguishing decisions many are making on which patients get the available ventilators and quite frankly, how to prioritize care when resources are low. So it's easy to imagine that there's a lot of stress, especially when not having enough PPE, and consequently worrying as you leave your shifts that you could potentially be bringing home the virus to your family and loved ones. All of this is, of course, an overwhelming burden, so it's easy to understand why anxiety and fear are likely leading to lasting mental health consequences from the COVID-19 pandemic. We've seen it before with the SARS epidemic, for example. In one study, 89% of 271 healthcare workers in Hong Kong reported negative psychological effects, including exhaustion and fear of social contact. So this is a real concern, and for the sake of ourselves, our families, as well as our patients, we need to take this seriously. And I ask you, if you are a physician feeling the emotional and mental stress of this time, please ask for help. Mental health care is available at most hospitals and clinics. Yet I know we may not feel that we have the time or the energy to take advantage of such services. So let's face it, as doctors, we are used to helping others, and sadly, we aren't the best at seeking help for ourselves. But I propose that we make an exception in our thinking this time to support our own well-being. So along those lines, I wanted to point out to please be on the lookout for an excellent opportunity that is coming up for ACOI members to get support. Very soon, the ACOI will be holding peer-to-peer virtual discussion sessions designed to encourage physicians to confidentially discuss their emotional health needs. More information will be published about that. It's really a good way to talk to others who are in your shoes and to relieve the stress that has been building for all of us. So please participate if you have a need. So let's end today's discussion on some really good news, and let's talk about Earth Day. So, although the virus is making our human lives difficult and really, quite frankly, changing the way we live our daily lives, the Earth is clearly happier. And I thought it somewhat congruous that on the 50th anniversary of Earth Day that we are seeing hopeful signs on the Earth's recovery from the impact of humans. Quite frankly, we're really seeing it everywhere, from the cleaner canals of Venice, where wildlife is now being seen, to the air quality in Los Angeles, in the Northeast, as well as around the world. Mother Nature is clearly thriving. And as humans, we are reclaiming public spaces again. Streets in some cities are being closed to allow for more pedestrian and bicycle traffic. So the good news here is that our impacts, this is on the Earth, and this can be positive, and that's better for all of us to live healthier lives. So just as a reminder about this, I also want to put a plug in for all of my colleagues here in New Orleans that once and for all, let's close the streets of the French Quarter and make it pedestrian only. I'm just saying. Anyway, that being said, I want you guys to know that the ACOI webpage is where you can find all these videos as well as the links that I've sourced. So please stay on the lookout for our regular updates. And to read more from the sources that's used in this report, please go to acoi.org/COVID-19. Together with the ACOI, we will help you have the latest information to help you respond to your patients as well as stay on top of the crisis. Also, please feel free to reach out to me at madery@mac.com. That's madery@mac.com. I really do appreciate getting your emails. I do respond to all of them. So please stay safe, and we can do this together.